Hello, my name is Dr. Paul Richardson and I'm the Director of Clinical Research at the Jerome Lipper Multiple Myeloma Center, Dana-Farber Cancer Institute in Boston. It's my pleasure today to talk to you about the pathophysiology of Hepatic Veno-Occlusive Disease, or as it's also commonly known, sinusoidal obstruction syndrome after hematopoietic stem cell transplantation. What I'm going to focus first and foremost on is the pathophysiology. Now, let's first of all discuss what is VOD-SOS. It's essentially a life-threatening complication of stem cell transplantation. The incidence rate is between 8 and 14%, but it can in fact occur up to 60% of patients who are at high risk. Those are patients typically defined by pre-existing liver disease, relapsed disease in terms of actually their underlying hematologic malignancy typically, and at the same time a variety of other contributing factors that can lead to them being at higher risk of VOD. And this also incorporates patients with neuroblastoma, in whom, for example, tandem autologous transplantation can often be used. Now, the important point is that there is a spectrum of illness. VOD-SOS can progress to severe VOD, which is associated classically with multi-organ failure, or as we also now call it, multi-organ dysfunction, and death. It's important to note that patients with severe VOD and multi-organ failure or multi-organ dysfunction have an associated 80% mortality or worse. This therefore constitutes an urgent unmet medical need unless there are effective therapies used promptly in its management. And obviously, in addition to prompt and effective treatment, there are also critical supportive measures that need to be used. Now, in terms of the clinical presentation of VOD-SOS, it's characterized by hepatomegaly, weight gain, ascites, and jaundice. Symptoms of VOD-SOS usually occur within 30 days following transplant, but can also occur later. Now, in terms of the pathophysiology, it's important to understand that the initial trigger is classically activation and damage to the sinusoidal endothelium due to conditioning regimen-mediated injury. And this results in an upregulation of a variety of key factors, including inflammatory cytokines. These activation of pro-inflammatory pathways and cytokines and development of a procoagulant and microangiopathic and hypofibrinolytic state lead to the classic cascade of endothelial damage, inflammatory cytokines, worsening microangiopathy, decreased fibrinolysis, and then VOD-SOS. It's important to recognize that this also is much more common in the allogeneic setting, where inflammatory disturbance is greater. This next picture illustrates the unique architecture of zone 3 of the hepatic sinus, where classically the damage occurs. And this is important to understand because it's in this particularly vulnerable and hypoxic area of the liver that the microvascular injury dominates. Now, the endothelial cells of this area are the primary target in VOD-SOS. The vascular endothelium is proposed to be, in fact, the primary target in transplantation-related complications that not only include VOD, but also extend to GVHD as well. Now, importantly, gene expression markers of vascular endothelial damage suggest that VWF may have utility in terms of predicting for increased damage. So when we think about activation and damage to the sinusoidal endothelium, these diagrams, I think, help capture this in the following slides. As you can see, we see in the context of vascular injury, upregulation of TNF-alpha, ICAM1, VCAM1, PI1, VWF, tissue factor, and heparinase, with downregulation of TPA. Very important structure is the space of Dease, which is the subendothelial area, which is particularly vulnerable to injury. The consequences of this is that through the activation and damage to the sinusoidal endothelium, there is narrowing of the hepatic sinusoids that can contribute to reduced hepatic venous outflow, post-sinusoidal hypertension, central venular occlusion, and as the disease becomes more severe, the emergence of multi-organ dysfunction, which worsens to multi-organ failure and ultimately to death. Now, this diagram illustrates this, I think, quite well because it shows gap formation, fibrin deposition, and narrowing of the sinusoids with particular injury in the space of Dease. Under the microscope, this is what this looks like on a trichome. This particular illustration is, I think, particularly informative because it shows the classic subendothelial edema that is classical and the microvascular occlusion that's abluminal that underpins this disease. When we look at the actual staining of this particular photomicrograph, you can see here actually the intense fibrosis, and stuck in the middle of the central lumen here is in fact a detached hepatocyte. So I think this serves to illustrate hopefully the underlying pathophysiology that underpins VOD-SOS and helps in our understanding of the pathogenesis of the disease and its sequelae. I want to thank you very much indeed for kindly listening to this presentation, which I hope has been helpful. Thank you again.